So I want to start with a joke. Yes, there is an appropriate joke for this situation. It is old, so just laugh anyway if you've already heard it. Mrs. Murphy was a devout Catholic. She went to church every day. You can use that next week. Feel free.
Well, Mrs. Murphy, though.
Okay. Well, anyway, we'll go with it. So Mrs. Murphy was a devout Catholic. She went to church every day. She was active in her parish for many, many years. So when Mrs. Murphy passed away, she left her money to the temple down the street, the Jewish temple. So the priest was beside himself. He was aghast. Why would this woman, who was so devout, so Catholic, so involved, why would she leave her money to the temple down the street? It didn't make any sense. So finally, he took it upon himself to go down to the temple and ask the rabbi why this happened. Asked the rabbi, she's so devout, she comes to church every day. Why did she leave the money to you? And the rabbi said, because I asked. And that's why we're here today. We are here to ask our representatives to support us in the important work that we do. We've been referred to as charities, as do-gooders, but we're so much more than that. The reality is that nonprofits touch us all every day in many different ways. We're schools, we're hospitals, we're community health centers, we're financial institutions, we're housing, we're public arts. We are a sector there are 33,000 nonprofits here in Massachusetts alone. 1 in 6 residents are employed by a nonprofit. That's enormous. We have income in excess of $2.3 billion and assets in excess of $2.7 billion. So we're definitely much more than do-gooders and charities. We are an economic engine and many oftentimes a catalyst for change. As an example, my organization, the Coalition for a Better Acre, invested $43 million in real estate development in the Upper Merrimack Street corridor, along with House of Hope in their investments. We revitalized the neighborhood and changed the face of it. I believe that UMass Lowell's latest project, University Crossing, would not have happened without the work of the nonprofits who invested in that neighborhood first. Merrimack Valley Housing Partnership, their graduates will buy every year somewhere between $35 and $50 million in real estate. That's annually. The latest catalyst for change here in Lowell has been Mill City Grows. They go into dense urban neighborhoods and create gardens, green space, community, and allow immigrants and low-income residents to grow culturally appropriate food and decrease the cost of their budgets. Now, the reality is we could go on and on. There's many nonprofits, and instead we're going to have you hear from them today. But I do have another ask that I want to specifically mention, and that is there are 2 bills pending before you that impact the residents that we serve, and that is the increase in the minimum wage and the establishment of earned paid sick leave. Now, we know that you heard from the business sector last week or whenever that breakfast was about their concerns in their business, and those are legitimate. But we're here to ask you to support those 2 pieces of legislation because we know that the residents that we serve are directly impacted by that. Now, we are, in this country, a consumer-based economy. That is the biggest amount of money that comes in. But our residents, many of them only make minimum wage, and they cannot even afford their basic needs for food and housing. Many even have 2 jobs, and still they're not getting ahead. So we would ask you to help support these bills to provide them with a living wage. And in terms of earned sick leave, they have to choose between going to work sick or staying home, not getting paid, and decreasing their income further. In Massachusetts, there's almost 1 million people without that benefit that we take for granted. So hopefully you'll support that when you go forward in the legislature. Now, the last thing I want to say is, one of the benefits that I receive from the Nonprofit Alliance is the collaboration between members. And this setting today is a result of that. We're here in the beautiful Lowell Community Health Center space. And so for that reason, I would like to bring up Dorcas Griggs-Sato, who is the CEO of the health center.
Good morning, everyone, and welcome to Lowell Community Health Center. I so appreciate that this forum to acknowledge both the human and the economic impact of the not-for-profits in the Lowell area is taking place here at the health center. For those of you who aren't familiar with the health center, just a brief overview. We provide primary medical care for all ages, including obstetrics. We also have a pharmacy service. We provide behavioral health services for mental health and substance abuse problems. We have after-school and summer teen programs through our teen block focusing on prevention of violence, teen pregnancy, HIV, and substance abuse. We have in the community health education and health promotion in refugee and immigrant communities in particular. For example, working with English as second language classes and doing screenings in the community. We also help people to navigate the complicated health insurance system that we have launched in Massachusetts and in the country. In this particular space, we provide training for community health workers and for medical interpreters. The health center has over 350 staff, and over half of our staff are bilingual, bicultural. We have 35 doctors and nurse practitioners and 30 behavioral health providers. So our annual impact on the local economy is over $35 million a year. This particular building, which opened in December of 2012, so we've been open a little more than a year, represents a $42 million investment in the city. In addition to this building, we have 2 school-based health centers, and we're very proud of our Meta Health Center just across the canal, which opened in 2000 to better serve the Southeast Asian community in Lowell. So I want to, again, thank you so much for coming here today. I know that you support the not-for-profits in Lowell and that you make a big difference in what we do every day. And I'll start the presentations on different arenas of the nonprofits by talking about the health arena. And again, thank you for also supporting things that relate to health, behavioral health, and related programs, since so many of these programs do receive state funding. The delegation's support for public health and health care is so appreciated. Significant progress has been made in Massachusetts in the areas of health access, quality, and cost control. The implementation of Chapter 224 has included investing in models of care that deliver proven savings, such as community health centers, strengthening the primary care health safety net, helping us to respond to the growing number of people who are insured and are looking for health care. In the 1 year of 2013, the health center saw 5,000 new patients coming to the health center who had not come here before. Support from the legislature is required to maximize the opportunities of healthcare reform and to maintain a strong public health and healthcare provider system. While the changing healthcare environment with healthcare payment reform has presented challenges, more and more people are getting insured. I know at the health center, 25% of our patients used to be uninsured, and now it's down below 10%. So that's a big change and makes a difference in people's lives. And since financial access to health care is not the whole answer to being healthy, state funding is needed for other types of programs to address healthy living, prevention, and education. And I'll just highlight a few, but in your bags there are some blue sheets that give in detail some of the related line items and information. As far as the Massachusetts Department of Public Health, their budget has undergone drastic changes in funding with a dramatic impact on community agencies and hospitals. And funding from the Massachusetts Department of Public Health has been critical to many agencies and programs that benefit Lowell. These funds relate to urgent issues including youth violence prevention, teen pregnancy, HIV, substance abuse, school-based health centers, community-wide nutrition and active living efforts, WIC, domestic violence, refugee health assessments, the list could go on. And when DPH funding is cut, as it has been for many years, often at a greater rate than other departments of the state, Lowell, its residents, and the not-for-profit agencies suffer. There's also a program that has been in the city for several years now, a grant that goes directly to the city, and that's a Mass in Motion grant. This really focuses on how we can facilitate people in Lowell living healthy lifestyles, exercise, healthy foods, looking at corner store healthy food offerings. And this grant, some of the grants in the city, in the state, are funded with state funds. This particular one for Lowell is funded with federal funds that are ending 1 year ahead of schedule because of changes at the federal level. So we urge you to look at the possibility of state funds for Lowell's program. Another concern is the dearth of mental health services. And for many years, we've heard that the Northeast region receives the least funding for mental health services of any region of the Commonwealth. And given the limited resources for mental health treatment, particularly for children in the Greater Lowell area, attention needs to be paid to this inequity. Two last issues I bring your attention to. First of all, the negative impact on behavioral health and primary medical care of limited reimbursement from Medicare and the Connector Authority. It's absolutely critical that rates for health centers, behavioral health providers, and hospitals be fair and adjusted periodically to reflect the rising cost of providing care. Lastly, there's a need to continue to cover adult dental through the health safety net and hopefully for next year through Medicaid. As I said, the details for all of this are in your packets, and really appreciate, again, your being here and listening to the nonprofits. The next person I would like to turn it over to is Amy Pescia, the director of the Merrimack Valley Food Bank.
Thank you, Dorcas. Your organization, Lowell Community Health Center, as well as all of those in the room and throughout the community, really make an impact and help improve people's lives, and we acknowledge all of your work. And we also, I would, on behalf of our staff and board of directors and the people we serve at the Merrimack Valley Food Bank, thank you to our delegates for your past support of MEFAP. MEFAP is the Massachusetts Emergency Food Assistance Program. It has offered nutritious food for our neighbors since 1995 in the Commonwealth. This safety net allows families to enjoy nutritious food and pay their bills. It's not always easy to pay your bills when you're unemployed or underemployed, and we want people to pay their bills because then they can keep their electricity on. Hopefully they can keep their heat on and remain in their homes. This year, with the significant reduction in SNAP, 900,000 Massachusetts families will face the reality of less food for members of their household. When SNAP benefits are cut, families go to local food pantries. Therefore, we expect to see an increased demand for nutritious food. The 4 food banks in the Commonwealth contract with the state government and Massachusetts companies and farmers to access and then distribute this food through a network of member agencies, including food pantries, shelters, and meal programs. We've all watched food prices increase in our own household budgets. The same is true for the food that we try to access, which is top quality protein, dairy, and fresh produce for the guests of these food pantries. For some of these families, the economic recession has not officially ended. Almost half of the people in need across the Commonwealth don't qualify for government benefits. They rely on the network of over 800 food pantries and other emergency food providers across the state to fill these gaps. To our legislators, by voting for an increase in the line item for MEFAP, you'll be giving our neighbors in your district and throughout the Commonwealth in all 351 cities and towns nutritious food so that they can work, if they're fortunate enough to work, look for work, so their children can learn, grow, and develop, so our seniors can take medication with food if needed. You'll be helping us access food, and that's what we're asking you to consider for an increase for fiscal year 15. The 4 food banks in Massachusetts are feeding as many as 801,200 people annually through our partner agencies. In Middlesex and Essex County, 129,000 people are accessing this state food. The Catholic Charities Food Pantry right here in Lowell is one of the hundreds of partners who help us distribute food to our neighbors who may have seen their resources slashed. We're grateful for the opportunity to talk about this program, this important program, share our request with you in this setting, and also to welcome a friend and volunteer of the Catholic Charities Food Pantry, Jim Wilcox.
Welcome, everyone. Obviously, my name is Jim Wilcox. I work at the Catholic Charities Food Pantry here in Lowell on Lawrence Street. I've been a member of the staff there, or volunteer staff there, for nearly 3 years off and on because of obvious medical problems, but I just want everyone to know here that it is very, very important. You see, being a volunteer, you see the people come in, you hear the personal stories. You can never judge someone by literally their looks. Everyone, 99% of the people that we serve are literally in dire needs of the food, any other services that we can offer. As a charity organization, people come in expecting one thing and usually get another, even as a volunteer. It wasn't what I expected. It's, for me, a very personal thing. I started out as a client and obviously decided to become part of the process, and I could never thank anyone, Regina Santos especially, enough. I absolutely love being there, and I could think of nothing else better than serving the community, serving the families individually. We've got items that we're given sometimes that are not necessarily food items. Toiletries obviously help, especially those in homeless situations. I always have something for the children. We call it the Jimmy Fund. A small smile on anyone can mean the world of difference. And many people come in with their heads low. They're obviously on their last legs. But one small item, just an item, one item, can change that frown to a smile. And I am so happy to be part of this. And I would love everyone to be continuing this. Not necessarily for me, because I really need it, but for these people. I am their biggest advocate. I would love to be out in the public myself, but this is my step for myself, being out there to help. And so many people I work with side by side are there for the same reason, and it means everything to these people. And you obviously you get some people who are not as grateful, but there's always a way to change that. Just one item will make the difference. So please help continue feeding these families. That's just my personal feeling.
But I really would like to focus on asking you to consider doing what we call forward funding, which is to put that same $20 million in the FY15 budget. And the reason that is so important is that our federal funding cycle is such that we don't know exactly how much money we're going to get. The funding runs out at the end of the heating season. We're frequently required to downsize our staff and then wait and see how much federal money we're going to get, and then delay the process of taking applications in from elders and families who really desperately need this fuel assistance. And so we find ourselves frequently in situations where during the early months of the winter, if winter comes early and hard as it did this year, we have people who are trying to process applications, we haven't quite gotten it through yet, and they're in emergency situations. The funding also typically provides the equivalent of 1 tank of oil. So imagine trying to get through the winter on 1 tank of oil. I had a few Fridays this year where We found ourselves sitting around at the end of the day knowing that we had requests in from folks who had basically used up that allotment. We had no additional fuel assistance money, but we're trying to figure out where else in the budget can we come up with money so that we can fill someone's tank of oil that weekend. The price of home heating oil has gone up. In 2003 and 2004, it was $1.45 a gallon. This winter, it's $3.94 a gallon. In fiscal year 10, we received in this area a little over $9 million in funding for fuel. This year, it's about $6 million. So we would certainly love to get more funding from both the federal and state government. But I think what's most important to us in terms of the state's partnership in this effort is to provide that money early on so that we can have the staff on board, process the applications, have fewer people in emergency situations in the early fall. And then if we get additional funding later in the year, either from the federal government, as also occurred this year, or from the state, we have the infrastructure in place so that we can quickly and smoothly process those applications and not have those emergency phone calls coming in on Friday afternoons and trying to decide what we can do to make sure that someone stays warm and safe in their homes this weekend. So if you would consider that in this year's House 1 budget, we'd be very appreciative. Thank you.
We are a collaborative organization which supports and advocates for the appropriate, accessible, and affordable mental health services for elders. We're also part of a statewide coalition, the Massachusetts Aging and Mental Health Coalition. And to that effect, we are supporting a line item in the state budget which is dedicated to geriatric mental health. Now, that's a good thing that there's such a line item in the state budget. The problem is there's no money in the line item. And hasn't been any money in that line item for a number of years. And so we know that when elders don't receive appropriate and accessible mental health services, they are much more likely to be placed in a nursing home and to never leave, to live in that nursing home for the rest of their days. We know when elders do receive appropriate and accessible mental health services, they're far less likely to ever get into a hospital or a nursing home, and they're going to stay in the community with their families, contributing as volunteers or even working. Now, we're asking for $350,000 in our $36 billion state budget. Seems to me that's a really good deal. $350,000 instead of paying millions and millions of dollars for nursing home care. So we're asking our state representatives today, as they look at the 2015 fiscal year budget, to support that line item with $350,000 for demonstration projects, and if necessary, to support an amendment on the floor if that becomes necessary. And we're asking our senators to go to the Senate Ways and Means Committee and to place that $350,000 in the state budget. And we're asking all of you to stand up for elders. Thank you.
Good morning. I'm Jean Phelps, and I'm the CEO of LifeLinks. Some of you know us from our past name, which we have not had in many, many years. We used to be called the Arc of Greater Lowell. I'm here this morning to speak to you about services for adults with intellectual and developmental disabilities. And I guess I want to preface my comments by saying thank you. We know it's hard for you to sit here and listen to each one of us make our ask and understand that this is probably one of, 50, 20, 100 events like this that you go to. And at some point in time, I think the buzz just gets really, really loud. And I think what you're hearing here this morning is that the need is always going to be there, and it's always going to continue to grow. And you have the unenviable task of trying to figure out where is the Commonwealth best served in terms of spending its resources. I'm here to ask you to consider spending your resources where you have in the past for services to adults with disabilities. In your package, and I'm not going to spend a whole lot of time going through it because I know that you've seen it before in other places, is the Association of Developmental Disabilities Providers budget platform for this year. And it speaks to a number of things. Services, funding for services for autism, funding for services for young adults who are turning 22, who are coming into the adult service network after having had exemplary special education services. An employment request critical to moving forward the governor's initiative around employment for all, and residential funding. And I'm going to actually just spend 2 seconds, more like 2 minutes, talking about residential funding. So Lifelinks is going to celebrate our 60th year of providing services to adults with disabilities in the Greater Lowell area this year. That's a very heady kind of thought to think that we've been doing this work for 60 years. For almost 30 of those years, we've been doing that work with the same level of funding. We have been funded at the same level essentially since 1988. In that time period, from 1988 until today, the Consumer Price Index has increased 102%. Our contracts with the Commonwealth of Massachusetts have increased 0%. So how do we do it? Smoke and mirrors, moving people around, getting incredibly creative, running a deficit. And we have run a deficit in our residential programs for years. But why do we do that? Why don't we just close our doors and close up shop and say, you know what, we can't do this anymore? For all the reasons why everybody sitting in this room does what you do. Because you have a passion, you have a love, and there's an incredible unmet need in the community. And were we to shut our doors, what would happen to the 62 people who are dependent on us for long-term residential services and supports? Our oldest resident, I believe, is 74 years of age. He doesn't have a family to go to. If we closed our doors and said, you know what, we're not going to do this anymore because it's just too costly, where would he go? Probably, as Frank said, to one of those nursing homes at an exorbitant cost. So the pressures of making a decision about what is fiscally responsible versus what is morally right or ethically sound are really hard decisions to make. We appreciate everything that you have done over the years to support services for adults with disabilities, and know that we have a true passion at Lifelinks to do the work that we do, and we anticipate that we will be doing this work for another 60 years. Thank you.
Hi again, my name is Jeff Foster. I'm the Associate Director of Political Action over at UTEC. I thought briefly about doing a mood check, but I figured it would take way too long, so I'm going to jump right into it. Before I start talking about numbers or FY15 budget, I do just want to ask that if there's three things that folks and legislators you take out of what I'm going to talk about today, it's that one, collaborative work across all levels in the community, from law enforcement to the providers around youth violence prevention. They're critical to our success in dealing with this issue. The second thing I ask folks to take away is that the three funding sources I'm going to talk about today are not interchangeable, that they're interdependent, and they serve a variety of different risk levels for young people, according to the Department of Public Health. And the third thing that I hope folks take away is that continuing to address youth violence in Lowell should not just be seen as prevention, intervention, or recovery efforts anymore. It's now really important that we start talking about youth violence prevention as a wise economic investment for the city as well. So I handed out some fact sheets. I think there's also some more in the goodie bags, and I ask that you reference that for more information. But as you can see on the bottom, there are three different risk factors from the Department of Public Health. Going from right to left, it's at-risk young people, then we have high-risk young people, and then we have proven risk young people. Now, in short, we're identifying risk as being behaviors that youth exhibit ranging from dropped out of high school, criminal involvement like getting arrested, gang involvement, homelessness, and the list goes on. The first funding source that falls under at-risk youth is our youth violence prevention funding. This currently funds at-risk youth programs in the Youth Violence Prevention Coalition, of which Lowell Community Health Center, Boys and Girls Club, YWCA, and UTEC are involved in. Last year, this helped us serve 675 youth through Lowell Community Health Center's Teen Block program, through the Youth Council, and also through UTEC's Youth-Led Candidate Forum. Currently, FY14, the city gets $80,000 for this. At its height in FY9, the city was getting more than double that at $200,000. If we were to be able to be restored to that level, the collaborative work across that coalition would be able to be more than doubled, and the impact could be felt citywide. I would like to recognize LCHC for their lead on this grant in the past, and thank Linda in particular for your leadership on that. Next, we have the Shannon Anti-Gang Grant, which I'm going to start off by really, truly thanking, with appropriate eye contact, the legislators who were true leaders on this. Seriously, true leaders on this. These guys fought really hard to get an additional funding mid-year for the Shannon Grant, which came to Lowell to the sum of $569,000. This is a really critical program that funds local law enforcement and community partners to do mental health work, community outreach, education, and other prevention work directly related to gang violence. It was funded at $17.2 million. Thanks to our delegation's leadership, it got raised to $18 million, and we're asking for that again in the FY15 budget. Lastly, we have the Safe and Successful Youth Initiative, or SSYI. This is relatively new funding source. It was a governor's initiative a few years ago, and this was created to fill a gap in youth violence prevention funding. This funding targets a specific list of, in 11 communities, 100 or so of the most proven risk young men ages 16 to 24. The state defined this. I'm not a huge fan of the definition, but the state defined these young men as being most likely to kill or be killed. We say the top 100 young men 16 to 24 most likely to be involved in violent crimes. To date, the state legislature has passed in the annual budgets at $4 million, but we've learned every year the price tag falls around $9.5 million. Every year to date, the governor's had to push out a supplemental budget. I would like to also recognize our delegation for just this week passing both in the House on Wednesday and in the Senate on Thursday a supplemental budget that would give an additional 4.8 to SSYI, but we ask going forward in FY15 that budget out the gate could be around $9.5 million. In short, for SSYI, I just want to reference a meeting yesterday we had, and Carrie Dates is in the room, and Carrie is the coordinator for SSYI citywide, that we had an official from Commonwealth Corps who oversees the administrative side of SSYI, and he pulled me aside, and he said, Jeff, I got to tell you, being in this room and seeing the collaboration from folks all the way in local law enforcement to all the providers across the city, this is the exact goal that SSYI had in mind. And he said, no other city's doing the level of work that Lowell's doing regarding the collaborative work across all levels. And you can see on the fact sheet, there's a long list of different providers and folks that benefit from the funding and they're able to provide services. Unfortunately, UTEC's Executive Director, Greg Coteau, couldn't be here today, but I did want to quote an op-ed he wrote in the Lowell Sun about youth violence prevention funding. He says that when the Commonwealth maintains its commitment to addressing youth violence, the benefits go far beyond public safety. We spend $46,000 per person for incarceration annually. And there's more costs on top of that, like healthcare coverage upon release. Yet high-performing youth organizations, like many of us in this room, we're able to serve a young person for less than a third of that, for $10,000 to $15,000 a year. We can no longer regard this work as purely prevention or intervention, but also a wise economic investment for the city. Again, we're asking legislators to please support continuing to fund youth violence prevention efforts in Lowell. From 2012 to 2013, the city of Lowell saw a 44% decrease in gang violent related crimes. That's major for the city, and we should be really proud of that. The collaborating agencies, really long. Again, reference your list. There's many folks here in this room and out in the community that couldn't be here today because they're busy doing the work that really do benefit from this programming. We ask for youth violence prevention funding to be restored to $200,000 for the city, that the Shannon grant be continued at its $8 million mark, and that SSYI in the House budget coming up, and again in the Senate budget, could be funded out the gate for $9.5 million to prevent the need for a supplemental budget next year. Thank you to all the partner agencies in the room and out in the community that are doing the good work. Thank you, LCHC, for hosting us. And now I'd like to introduce the Development and Communications Coordinator, good friend of mine over from the Acre Family Child Care, Alex Tubielli.
Thank you, Jeff. Good morning, everyone. I feel like I'm so far down the line, it's going to be hard to follow everybody, but I'll do my best. So my name is Alex Tubielli. I work at Acre Family Child Care, and I'm really happy to be here with all of you and also feeling a lot of pressure representing child care, not just in the community of Lowell, but for all the families across the state, I guess, that feel the same way that I do, that this is really important. Thank you again to Lowell Community Health Center for hosting this wonderful event and the NPA for organizing it. And I'd like to thank a few more people. I want to thank my Executive Director, Kathy Redeker, for giving me the opportunity to speak today. And I want to thank a very special person to me. Her name is Araceli Zuluaga. Does anybody, other than the people from Acre, know who Araceli Zuluaga is? Great, because I'm going to tell you. So, Araceli Zuluaga is a small business owner. Her business is located here in Lowell. It's called Amour's Daycare. She started her business over 15 years ago. Now, I first met Araceli 4 years ago when I started working at Acre Family Childcare. Acre Family Childcare is a nonprofit located in downtown Lowell. We were founded over 25 years ago. Our mission is to help women provide. Our mission is to provide pathways for women to achieve economic independence through opening their own family, their home-based family childcare. I'm rushing through this part because I feel like, as much as I love my organization, I don't really want to spend too much time plugging it. So, our vision, in addition to helping women achieve economic independence through owning small businesses, is to ensure that all children throughout our community, regardless of the income of their parents, have access to a high-quality early education. Well, why is this important? I think that I will answer that question a little bit later for you all. But the important point that I want to start with is that family childcare, be it a family childcare system, a center, an organization, or many of the independent business owners throughout the city, help make it possible for women like myself, for dads like my husband, to work. It's an important part of the infrastructure of this community. And in addition to providing services to people who use their businesses, they're also small businesses providing jobs and providing stability in families and communities. Now, Acre is one of many family childcare systems in the city. Additional systems include Clarendon Family Childcare, Child Development, Bethel, services offered through community teamwork, and many, again, hundreds of other independently owned small businesses located throughout the city of Lowell. Now, right now, I'm just talking about Lowell. Also, in addition to family childcare, there are center-based programs. Some center-based programs here in Lowell include Lowell Day Nursery, Community Christian Childcare, Little Sprouts, Merrimack Valley Christian Day School, Creative Beginnings, and again, various centers managed by CTI, the YMCA, and the YWCA. So it sounds like a pretty long list, but I have another question for you all. How many Dunkin' Donuts did you pass on the way here today? It was more than one, I'm assuming, right? Okay. How many other coffee shops, like Brood, did you pass on the way here today? Probably more than one. And I'll bet that you saw all of them and the signs that were up talking about how important coffee is and how America runs on Dunkin' Donuts. And I'll bet many of you, like myself, though I'm drinking decaf now, feel like if I have that cup of coffee today, I can work. I will be great at work today. And not only that, my coworkers will find it much easier to be at work with me today. Because my mind, I will be able to focus and get things done. So another question, I have a lot. How many childcare businesses did you pass on the way to work today? How many of you even noticed any of them? So you might have seen the center programs because their signage is a lot bigger. But I'm pretty sure some of you may have even passed my family childcare program where my son is right now, and you didn't even know. Childcare is everywhere. Why is childcare everywhere? Because it's a business that has a lot of customers. Communities across this country, communities like Lowell, run on this invisible infrastructure that is childcare. Investing in childcare has three important, huge impacts. The first one, people who work in childcare have jobs. The second one, people who depend on childcare can go to work, or people who need childcare and get childcare can find work and keep work. And the most important part of childcare is the child. Children who have access to a quality education experience are more successful in school and in life, period. That's the shortest way I could possibly explain it. And if you can find a cup of coffee that promises you those three things, please let me know. I'd love to have some. I will get some on my way out. Sorry, Andy. That infrastructure is important, just like the infrastructure that is roads and bridges and traffic lights. And I'm pretty sure that if a traffic light at a major intersection stops working, you notice it. When a new bridge opens and everybody's confused about where to go, you notice it. Or when an older bridge, let's say maybe a famous one, that's a huge part of infrastructure, has something like a lane closure, the whole country notices that. Other parts of infrastructure, electricity and power. How many people lost power here in Lowell for a couple days 2 years ago when we had Snowtober? I had candles and was showering at the gym because I had no heat and I had no electricity to run my household. I was cooking food at my friend's house. It was a great experience in building community, but again, not something that I'd like to, make regularly happen. Childcare as an infrastructure piece is dependable and strong here in Lowell because of the thousands of people that are a part of that network, that support that network, and make it run every day. But sometimes there are problems with that infrastructure. And you may think, I don't have a kid in childcare, so how would that affect me? But I have another question. If you have a coworker who can't come into work and you have a big meeting that day, don't you miss them? Now, if you're somewhere like a large, for-profit business and not a small nonprofit, you might not notice somebody not being there. But when somebody is absent on our team, we feel it immediately. What about your neighbor who may lose their house because they don't have a job? That job could be their small business. That job could be a part of a childcare program or center, part of that delivery system that's no longer there. Or what about your neighbor who loses their house because they lost their job because they couldn't go to work? Do you feel that yet? But I'd like to ask you one last question, and that is if you will prioritize increased investments in high-quality early education and care for the fiscal year budget of 2015. With your help, we will not only continue to thrive and make a difference in the lives of parents and families now, but we will be able to power, through this wonderful infrastructure, the leaders of tomorrow. Thank you all. And when you think of coffee, think about the invisible infrastructure that is childcare and how awesome it is that we have it to stand on.
Good morning. My name is George Nugent, and I am the Vice President of the Nonprofit Alliance of Greater Lowell, and I also work with Lowell Community Health Center. I'd like to thank all of our panelists this morning for speaking on the social and economic impact of nonprofits in Lowell and the Greater Lowell area. We are going to take a brief break from the panel and allow our legislators to speak. The first legislator that I would like to call up is Representative Kevin Murphy, who represents Lowell. Representative Murphy is an advocate for increased access to health care and education. Representative Murphy, if you'd like to say a few words.
It's great to be here today. I was a little confused. I told Dorcas when I walked in, I heard these numbers being called. Number 3, you're next. I thought I was at the registry of motor vehicles. But it works, and it works great. What a great facility this is. And it was interesting, Amy, listening about your cooperation now with the Greater Boston Food Bank, because it wasn't like that 18 years ago when I was a freshman representative. My first budget earmark is in their words, I stole $600,000 from the Greater Boston Food Bank and gave it to the Merrimack Valley Food Bank. I thought I was doing a good thing, but boy, it started a maelstrom in the House of Representatives and the Senate. But we were able to continue to get that money, and I'm glad to see you working together. That's yeah. Well, 18 years ago it wasn't a love fest. But I tell you that story because 18 years ago, when I was a freshman representative, I understood the importance of not-for-profit organizations. If we didn't have not-for-profit organizations in the Commonwealth of Massachusetts, imagine what a negative impact that would be on our society, because we don't have enough money to pay for all of the great things that you do in our community and make it better.
For those that don't know, Lowell was one of the first cities that had a comprehensive cultural plan in the state, recognized the importance of arts and culture. And a lot of things have changed over these past years because of that. We have over 800 artists living and working in Lowell, as well as there's a huge number of those that just work here in Lowell by having studios. We have more than 25 cultural institutions in our cultural district, which, if you don't know, the downtown plus sort of a segment where Western Ave Studios is the downtown or the Greater Canal District of Lowell. It was recently designated about a year ago now. We have 2 Smithsonian affiliate museums, and Western Ave Studios is one of the largest artist studio complex of its kind in the country. At 53,000, we have the 7th largest cultural council, the Lowell Cultural Council, and that's via allocation in the state, funding which supports this past year 45 individuals and organizations. And even more importantly, between Lowell Folk Festival, Winterfest, Southeast Asian Water Festival, city events, and then all the open studios and events like Linda's Encore Dance Troupe, we have attracted over 1 million people into the city, which makes culture and tourism one of the largest impactors of our local economy. And putting on the business hat for a second, I can, greatly appreciate that, because for those in the downtown, we do rely on tourism, both from the arts and the cultural districts. So what we are asking our legislators to do is to provide consistent pressure and restoring higher levels of funding to MCC, the Mass Cultural Council, and the State Tourism Fund. And right now we have 8 major institutions that receive operating support from the MCC. We have 5 organizations that received critical facilities funding. And as I mentioned, this year we had 45 individuals, organizations receive money from Lowell Cultural Council, but it's been ranging, depending on the amounts asked, anywhere from 20 to 50 individuals and organizations. So the funding is critical. It's important. Not even that. It brings the city alive. I always look at it. We have a historic department that maintains buildings and roads, but our culture and our arts is important, and that is going to be something that is always going to need to be remembered in any city and state. So it is critical and important for businesses, for artists to continue supporting the arts and culture. And not just going to the legislature and asking for this money. I urge legislators and everybody to make sure that you are attending events at the theater, at the open studios and galleries, and purchasing art as well. So, thank you.
I'll apologize to George, first of all. I didn't realize that I was to be at this table, so I was in the back of the room. My name is Paula McCarran. I'm the Executive Director of the Merrimack River Valley House in Lowell, a not-for-profit residential care home serving women age 62 and over, and has been doing so for the past 145 years. We're part of a network of residential care homes across the state of Massachusetts, and in particular, I'd like to address today our ask for support of elder service programs as well as the residential care homes in particular. My own process in becoming involved in elder concerns and the issue of aging actually started when I was in high school. I started working in the laundry and the housekeeping departments of a Lowell nursing home. And I have stayed in that realm of elder services my entire life. It wasn't my direction originally. I sidetracked, I've never regretted it, and I become more passionate with every year that I add to my life. One of the best statements that I saw was on a t-shirt. If anyone here suffers from some of the anti-aging phobia we seem to have across the country, his t-shirt proudly pronounced, "I'm 18 years old with 42 years of experience." So I hope that brings some levity to the topic. In my role as director of the Merrimack River Valley House, I do have the privilege to network and partner with many elder service providers throughout the Merrimack Valley and across the state. I'd like to highlight a few places where all of us can help bring advocacy and action. One is through the Leading Age organization. It's an Alliance membership organization of not-for-profit services, and on their website you can access and learn about pending legislation and appeals that are being made, and then bring those items to the attention of your legislators if you're so inclined. The other issue, report that I'd like to have made known to people is the Community Profiles Report of 2014, highlights from the Massachusetts Healthy Aging Data Report. This entire report would print out to be about 140 pages. It was compiled by the Tufts Health Plan Foundation. In this report, you can see region by region across the Commonwealth and particular communities. Every city and town has a listing, the percentage of people over 65, whether they're married, single, divorced, widowed. if they're renting, if they live independently, what type of home they're in, what their income levels are, if they consider their city to be walkable for seniors, if they believe that they have access for transportation services, including the rates of chronic disease in every community, whether they are ranked higher or lower in whatever the issues are that are facing the aging populations across the Commonwealth. It's a great baseline of data for looking at the development and the support and funding for services and identifying need areas. The other item that I'd like to speak to is the State of Plan on Aging, which can be found at the website of the Executive Office of Elder Affairs. In that report are outlined 7 goal areas for the Commonwealth and the corresponding strategies for achieving the goals relative to concerns of aging adults over the fiscal years of 2014-2017. While every goal is worthy in its own right, I'd like to bring attention and focus to goal number 5. It is to strengthen housing with service options and to address the needs of people transitioning out of facility-based settings. Without safe and affordable housing options that allow for services, many individuals will not be able to maintain or attain community living. This is the piece and the goal that speaks most dearly to me at the present time, because it's what I see every day in my work at the Merrimack River Valley House, and I share with the rest homes and the residential care communities across the state of Massachusetts. Many older adults simply do not have the ability to live independently in the community. They may, in fact, be in need of a residential care setting which offers a chance to be in a more home-like environment, have optimal independence, and the availability of 24-hour services as needed. These individuals often do not have family support, nor do they have the finances for private pay services. They may not be able to afford private assisted living homes, and admission to nursing homes is premature, not to mention costly. A typical nursing home cost runs $8,000 to $9,000 a month at present, and the cost of a rest home, for example, would be in the realm of $3,500 a month. Rest homes, like the Merrimack River Valley House, provide individuals with the avoidance of premature nursing home admission, the opportunity to live comfortably in a community where they're supported, and it also provides for affordability and subsidized stays which are made available to people of low and moderate income through programs funded through the Department of Transitional Assistance. For older adults, a residential care home may be the best option in terms of care, service, and cost. My ask is that while we focus on the needs of older adults in our communities and the need for new services, that we strive also to support and invest in the existing services such as residential care homes, which have proven their value over time through excellent care, highly personalized service, and affordability.
It's really great to be here with you today. At this time of year, the legislators are very busy. Representative Golden, Murphy, and Nangle and myself hear from a lot of people because it's budget time. And so they come to our doors and raise their priorities with us, which is really important that we hear from you. One of the things that we talk a lot about, of course, and I think it's one of the most important things we do, is handle the budget for the state. And though it's $35+ billion, much of that is already spoken for. So the dollars that are not spoken for, as you can imagine, are hotly contested. And so it's so important that we hear from our constituents as to what your priorities are. And today has been, again, a wonderful opportunity to hear from the nonprofit alliance here in the city of Lowell so that we can see and hear once again the good work that you're doing, whether it's from the very, very young, the youth in our community, through elderly and the services that are necessary for our elderly. And this is something, you know, we oftentimes in the legislature like to think in terms of where we're going and big dreams and how do we improve the Commonwealth. But what you do every day is really the most important. You're taking care of the people in our society that need our help the most. You do it day in and day out. The dollars that you ask from the legislature are small in comparison to the good that you bring to our community. And so I can tell you that you have our support. You've had our support year in and year out when it comes to those tough budget fights, starting with our ask from our chairman of Ways and Means all the way through the process. And we will continue to do that. I have a whole bunch of statistics that I'll spare you because I have a feeling I'm preaching to the choir. I think you folks sitting here this morning know the numbers probably better than most legislators as far as what's in the governor's budget and what's likely to come. But Representative Murphy gave you a good bird's eye view as to where we're at in this year. So the governor put out his budget, and that's a starting point.
I want to say thank you very much for putting this together today. Many of the folks up here I know them very well because of the constant communication that we have back and forth when it comes to what is needed. I think I just want to reiterate what Senator Donahue had said and Representative Murphy. We need to hear from you. I think this is extremely important. I think that you should know that the Lowell delegation is always looking for more information from you because it's extremely important that we know what matters to you. The folks here and the folks out here, obviously you're taking care of our constituents, your customers, your clients, however you want to talk about them. And you really take care of from A to Z, from Alpha to Omega. You really, I mean, we have everybody up here today that takes care of from the youngest to the young and sometimes guys like me who are getting older by the day, at least it feels. But I think it's important, truly, to engage. And I think it's important that the takeaway here today for all of you is to make sure that you go back to your organizations and make sure you talk to the people that you work with. And make sure they continue to reach out. Because over the next 2 to 3 to 4 months, it's going to be extremely busy and it's going to be loud down on Beacon Hill. And quite frankly, from a legislative standpoint, we're bounced from this meeting to another meeting to another meeting to yet another meeting. And I know that I was talking to the Senator earlier, and her schedule is fairly busy today, as is mine. But the reason I'm saying that to you is because we really, truly believe in what you're doing. But we're going to get off track on our next meeting or the meeting afterwards. So if I can ask you, don't hesitate. As Senator Donahue had said, make those phone calls. Speak to the people that you work with to ensure that they call us as well. We know what you do is important. Heck, I can't tell you the number of times I've called over to each one of these organizations because of an issue or a problem, and it's always, been solved or attended to. Some of our issues we just can't solve. We know that. But today is a day to continue the communication. Make sure the communication continues next week, and the week after, and the month after, because there is an old saying, sometimes a squeaky wheel, and everybody knows it. But it is true. We need to continue to hear from you to what is important.